Okay, good morning all. Today we are going to see about the history taking in gynecology. You can see the history taking and physical examination in gynecology. So first, why we should take history in gynecology? Importance of history taking in gynecology. What is the importance? That is the study of diseases of female genital organs. In female genital organs, what are the diseases causing that we are deals with the gynecology. So history must be taken in a non-judgmental, sensitive and thorough manner. Should not be any more judgmental. We should be sensitive and in complete manner, thorough manner. We should take the history, collect the history from the patient, and also must give given towards maintenance of patient-physician relationship, and how the patient-physician relationship also we should be maintain good communication with the patient in order to elicit proper history and to be accurately able to recognize her problems. Kindness and courtesy must be maintained at all times. It is important for a male doctor to take history and perform vaginal examination in presence of a female attendant. Clinician must adopt both an empathetic and inquisitive attitude towards the patient. The patient's privacy must be respected at all costs. Must refrain from asking personal questions until appropriate patient confidence has been established. Needs to listen more and talk less while taking patient's history. Must avoid interrupting, commanding and lecturing while taking history. If any serious condition is suspected, the diagnosis must not disclosed to the patient until it has been confirmed by performing investigations. For example, if you are taking the history, while we are taking the history, we are feeling that maybe the mother is having any type of the carcinoma or anything. We are suspecting by our we have studied many of the conditions and we are taking the history now. So in that time we are feeling that the mother is having any type of but carcinoma or something is feeling, we should not be tell about the patient. After getting final that accurate report only we can convey that message. Then honest advice and opinion must always be provided. Various available treatment options along with their associated advantages and disadvantages must be discussed with the patient to enable her make a right decision. And components of history taking: general information, chief complaints, then menstrual history, obstetric history, history of present illness, past medical history, personal history, family history, socioeconomic history, drugs and allergy. Then general information: name, age, relation, occupation, husband name, age, occupation, marital status, address, date of admission, mode of admission, date of examination. And chief complaints: bleeding for vagina, abnormal menstrual bleeding, discharge per vaginum, mass per abdomen, abdominal pain, amenorrhea, unable to conceive, something coming out from per vagina, urinary problems and sexual dysfunction. Then coming to the menstrual history: age of menarche, cycle length and regularity, days of flow, number of pads changed per day, passage of clothes, last menstrual period, associated symptoms, lower pain, abdomen or back pain. Then obstetric history, we should see that number, date, obstetric history in number, that is the first pregnancy, second pregnancy. Now how many pregnancies are there, that is the number we should, that year and even in which year that first pregnancy was, the pregnancy events, how the labor delivery, how it is the normal delivery or the cesarean section, that is labor delivery details, that how. Then the method of delivery, that is the normal delivery or cesarean section. Puerperium, any puerperal history, that is puerperal pyrexia, puerperal sepsis, puerperal postpartum hemorrhage, like this. Any postpartum complications is present or not, or normal. Then baby weight and sex, birth, asphyxia, duration of breastfeeding, contraception, these all things should be mentioned. Number of living children, boys, girls, health status of the baby, immunization, last childbirth, these all should be mentioned. Contraceptive history, any contraceptive is used, husband or wife, type, duration, any complications faced when they used contraceptives. So next, history of present illness. Abnormal uterine bleeding, that is the normal cycle is 28 plus or minus 7 days, duration 4 to 5 days. Menorrhagia, menorrhagia means excessive uterine bleeding in amount that is greater than 80 ml or clots, or duration greater than 5 days, but the cycle is maintained. Pathology of uterine cavity of the uterus, fibroid, then uterus, fibroid uterus, then infections of the uterus. Then polymenorrhea, if the cycle is short, that is less than 21 days, with the normal cycle, it is of frequent bleeding. Ovarian pathology or pelvic infection, that is pelvic inflammatory diseases like this. Then polymenorrhea, if heavy frequent bleeding, hypothalamic pituitary ovarian axis abnormalities, endometrial polyp or other endometrial problems, PID, pelvic inflammatory disease, stress of the situation. These all each conditions you will be studying in detail later. Then metrorrhagia, no regularity of flow and cycles are also abnormal. Then lesion in cervical area, vulva or vagina, abnormal pregnancy condition, abortion, chronic ectopic or molar pregnancy, post-coital bleeding, spotting after intercourse, carcinoma of the cervix, oligomenorrhea, cycles are longer, that is greater than 35 days. Then discharge per vagina, onset, duration, amount, profuse scanty, color yellowish greenish curdy, if blood stained, foul smelling, associated fever, itching, urinary symptoms, any relationship with the menstrual cycle, if on any antibiotics or any topical application, if a known case of carcinoma of genital tract. Then physiological leukorrhea. Leukorrhea means that is the whitish discharge, sexual excitement, of ovulation, premenstrual pregnancy, that is the physiological changes that can occur. Then infective conditions, chlamydia, candida, Gardnerella vaginalitis, trichomoniasis, chronic cervicitis, foreign bodies, polyp, malignancy of genital tract, ring pessary on senile age group. Senile age means old age groups. Mass per abdomen, size of the mass, first noticed at which site, then duration, change in size, mode of onset, association with pain, fever, presence of other lumps, loss of body weight, any secondary change, anorexia, features of pressure, effects. Then coming to the physical examination, we have collected these all histories we have collected. After that, with this history, we can do the physical examination of the mother and then go for the further investigations. Okay. Then physical examination, gynecological physical examination, general examination, abdominal examination, pelvic examination and rectal examination. Mainly 4 types of gynecological physical examination are there. General examination, then abdominal examination, pelvic examination, rectal examination. Then gynecological physical examination, general examination, we should collect height, weight, BMI, body mass index, vital signs, hands, mucous membrane, supraclavicular area, thyroid, chest, cardiovascular system, respiratory system, breast. Then abdominal exam, inspection, palpation, percussion, auscultation. Same on the obstetrics also we are doing, but the type inspection is different, palpation is different, percussion is not there, in that it should be that instead of percussion is the absent in the obstetric conditions, and auscultation is there. Inspection, distension is sometimes in fibroid uterus, distended abdomen will be seen. That masses while and also we can see some bulging like that. Yes, some masses are seen somewhere like this in the abdomen. Then surgical scars, that is due to previous any appendicitis, appendectomy, likewise any previous surgical scars or CS scar or hernia, like there is any scar. Palpation, guarding, tenderness, masses. That then percussion, useful in free fluid, is suspected. Auscultation, not specifically useful for gynecological examination. In case of acute abdomen with the bowel obstruction or postoperative patient with the ileus, listening to bowel sounds. That is in obstetrical cases only auscultations are is important. Then coming to the pelvic examination, inspection, external genitalia and surrounding skin, speculum, bivalve or cuscus speculum. Two types of speculum are there, bivalve or cuscus speculum. That the speculum examination, note that speculum is that is how the cuscus speculum is inserted, you can see. That is the inspect the cervix. Type of cervical os is small around the dimple, nulliparous os or os in the shape of a smile. Multiparous os. Color normally pink, maybe redder area around the os known as cervical ectopion, or tinged blue in pregnant, red in cervicitis. Secretions, discharge, observe color, cervical mucus is ovulating. Then ulceration, scars and retention of sites, that is Nabathulian follicles. The cervicals were spasmic is taken at this stage. Then bimanual examination, rectal examination is used as alternative to vaginal examination, children and in adults who are not sexually active. Okay, thank you.